Hello, hello. All right, we're climbing up. People are actually on time a little bit. Look at that. I feel like D Nice right now. I got like the music going in the back. All right, guys. Hello. It's happy hour time. I feel like I should have like the mixing boards right here. We're going to give it about a minute. Let people ease in. You guys can tell me where you're all from. What's up, Doc? Anybody here from Stade or Switzerland? Jersey is in the house. I like it. Australia. That's the winner so far. Brooklyn. Okay, that's good. Buenos Aires. Wow, that's impressive because it's Camus time. A gimlet. Ready to rock. Whiskey? Oh, that's hard. That's a hard start. Absolute citron from the freezer. Crushed in a crystal glass. You guys are like professional here. Okay. I'm psyched about the international group. Happy Friday, everybody. I'm doing my favorite thing in the world, which is talking to myself. Welcome to this. I think it's the second Hot Topics Happy Hour. We've been very, very busy here at PFRANKMD. Most of you who follow me, thank you for following as my audience on social and on the website and on TikTok. And we've been busy at the downtown office. We had a great season in Miami this year. Hampton season's coming, and the beauty industry is booming. I'm a little surprised at how busy it is, but there's a lot going on, and I'm going to talk about all this today. For those of you that are local or are international or not local and can come to New York, I invite you all to come for a little free tour. All the editors out there, we'd love to have you. We're working both offices at the same time now, uptown and downtown. And I think, we're all vaccinated and we're really 100% capacity back to the full swing of things. During the pandemic, we were kind of spacing things out. I think all service industries were doing this, particularly in the healthcare industry. But I'm happy to say that everyone is healthy and we are at full capacity. So what are we going to talk about today, guys? We are going to talk about industry trends, what is going on in the beauty industry. I'm going to focus on body a bit. It's hot and summer is coming. And I think, as I'll discuss, a lot of the trends that are going on now are very body focused. We're going to talk about some of the technology trends that I discussed back in October in my last Hot Topics Happy Hour. A lot of these devices and treatments have come out now. So I'm going to give you the 411 on what this is all about. And finally, I'm going to do some rapid fire questions. We got an enormous amount of questions coming in. And as we go along, if I see any shout out questions, I'm going to let you guys chime in and, we'll take it from there. But first, as we wait for a few more people to come in, we're going to do one of my polls. Okay, this is my favorite poll, and to really find out what everyone is drinking. So let's launch this poll. I think I'm getting good at this Zoom thing. And here we go. All right. What is everybody drinking? Wine, the hard stuff, non-alcoholic. I don't drink fluids, and I am very thirsty. I'm stuck under a large object, and I have nothing to drink, and I can't reach it. So first of all, while you guys are answering this, I want you to tell me if I look okay. I did not have time for hair and makeup. And I know, as with most Zoom things, we're really going to be spending our time looking at ourselves at the Zoom camera, right? Does anybody actually look at other people when they're in a Zoom meeting? They could basically put a picture of themselves up there and no one would notice it. Thank you. I accept those compliments. Thank you. Anyway, let's see what this poll says. And we're going to share results. So people are drinking wine and non-alcoholic, a few of the hard stuff, a few of the very thirsties, but okay. So people are actually partaking. And that leads me into the next discussion. I've gotten an enormous amount of questions and feedback about alcohol in the skin. Everyone wants to know what is bad for the skin, what is good for the skin. I talk about this in the Pro Aging Playbook. I've spoken about this on my podcast. I've been a guest on other podcasts. And the fact of the matter is, you all know I do like an occasional glass of wine. I'm drinking 𝐏𝐨𝐻, by the way, today. This was given to me as a present. In case any of you are thinking about getting me a bottle of wine as a present, I do like 𝐏𝐨𝐻. And although I do like alcohol, and I too was once young and can tolerate imbibing a bit more than I can now, everyone seems to be more concerned about other toxins in their life, where alcohol is probably the worst thing that we can do for our skin. Now, it does not mean you have to stop drinking altogether, but alcohol is the third leading cause of preventable death. It is responsible for over 20% of emergency room visits. It is carcinogenic. It kills every organ cells in the body. It changes your habits in eating and your cortisol levels and your hormonal status. It affects acne. It affects other diseases of the skin. And basically, it is just plain bad for you. So if we took away all the things that we fight about in the world, like parabens and certain types of chemical sunscreens and all the things that the skincare world seems to fight about, which is bad for you or not clean, it would not make a single-digit fraction of the impact that alcohol does for the overall health and our beauty and the quality of our skin. So I'm not telling people out there to stop drinking. We all can find some level of moderation, but heavy drinking is categorized for women as 7 or more alcoholic drinks a week. They say for men, it's 15. I'm not really sure. It sounds a little misogynistic to me, why men could drink twice as much. I'm not sure of the science behind that, but that's kind of the numbers that they go by. But the fact of the matter is, people, take your pleasure in occasional alcohol, but alcohol is bad for the skin. And when you're thinking about fighting about what to put on your skin, not put on your skin, think about things that instead of putting on, that you could subtract from your life. And I think alcohol moderation, nutritional moderation, minimizing sugar, minimizing simple carbohydrates, and certainly alcohol are probably the best thing you could do for the quality of your skin. It's not always about adding, it's about subtracting. So now let's stop sharing that thing about alcohol. We're going to shut this down here. Good. Let's start talking about trends. Now, for all the editors that are out there, and I appreciate you all joining in, I know the biggest story has always been the cosmetic boom. And it's true. It's not false. There's a huge aesthetic boom right now in the industry. And there are many reasons for this. People like writing and talking about the Zoom effect because we're all looking at ourselves every day. But you know what? This is not an uncommon theme. We were talking about cell phones and selfies and all that stuff. There's always some new technology of where we're facing ourselves. And yes, we are becoming more and more visual creatures. And you could blame it on MTV in 1981. But the fact of the matter is, there's always that technological stimulus of us looking at ourselves. I think one of the big reasons for the big boom in aesthetic surgery is the fact that people just didn't take as good care of themselves as they said. There was a lot of media attention to how self-care, everyone was getting more involved in it. But the fact of the matter is, I could tell you as a physician, people went through tough times, and rich or poor, I tell patients, if they're in my chair, things are pretty good because my practice is 100% aesthetic now. And, these are people that are coming for the extra services in life. So if they're in my chair, they're in pretty good state. But the fact of the matter is, people really went through tough times, and they didn't take as good care of themselves. They were out of their routines. So I think this aesthetic boom of doing something for themselves is very significant contribution. I think also retail therapy plays an enormous role in this. People want to spend money. The average household across the full socioeconomic spectrum really didn't spend as much money, and people are looking to spend money on themselves. And I think you'll find this not only in my industry, but in all service industries, boats, cars, jewelry. Friends of mine in all these industry, people want retail therapy. And then finally, everyone in COVID got dogs and babies. People got pregnant, people got dogs. I'm not sure the exact statistics, but it seems to me everybody's got a new dog and a new baby. Now, I don't perform veterinarian cosmetic dermatology, but I do treat mommies, and there is a huge boom in mommy therapy lately. So I want to hear from you guys what you think about how you fared physically. So we're going to take another poll. Okay, I want to know, how did you fare physically and emotionally through this whole thing. Okay. I fared great. I took better care of myself than before. I let myself go, and the stress and the change in routine actually continues. It was difficult, but I'm committed to returning to my best self, and none of this affected my routines. So let's give you guys a few seconds to answer that. I'm very impressed people are getting involved in these polls. Good. Okay. Let's see what everybody said here. Interesting. Like a third of people actually did take better care of themselves. But it was, I like the majority here. This is what I would have expected. It was difficult, but I'm committed to returning to my best self. And this is kind of what I expected. Definitely everyone had a tough time. People are looking to get their groove back. You know, it appears that everyone was affected by something, and those people who took better care of themselves, they're just annoying because it was tough for everyone out there. Okay, so let's move on, guys. So we know why there has been increase in demand, and this is the main conversation, but the question is this sustainable? Now, over the 20 years I've been in private practice, there has been steady and consistent growth. There have been peaks, and again, this is true amongst my peers. 2020 was probably the only year where we saw a period of significant decrease. And that's because most people in the beauty industry, whether you were an esthetician, whether you were doing hair color, whether you were a cosmetic surgeon, plastic surgeon, dermatologist, we just didn't work for a few months. I am impressed by how much everyone made up for 2020, but still it's tough to make up 3 months of absolutely nothing, particularly when everyone moved away. But I think, you know, we're seeing a huge peak now. I think it'll continue to grow. But I think the personal volatility in people's lives is what's going to drive this. You know, people are now, they're moving jobs, they're moving places, they're starting new businesses. I mean, as terrible as COVID was, I like to look at the positive implications that we could pull out of negative experiences here. And I do see a lot of people taking risks in new jobs. They're starting from scratch. I mean, I started my own practice 3 months I opened up. After taking out loans and building my office, I opened up my doors 3 months before 9/11. And as crushing as that was, once I got over the trauma of what was going on in the world and the loss of friends and what happened to New York, there's almost a feeling of freedom. Like there's the only way to go from here is up. And I think that type of promise we're going to see across all industries, particularly the beauty industry, which, you know, when people are seeking new opportunities in their personal life, in their career, a lot of people are getting married, people are having babies, they're going to seek out self-care type of things. So I think that's a good thing. And the future of demand, you know, what are we going to see? People are always asking me, what is the shift in the type of procedures that are going on? And there is no question in my mind, the most dramatic thing I have seen is a shift to more invasive procedures. Now, the last decade has really been a shift to less and less invasive, but I'm seeing a dramatic boom in people wanting more out of their treatments and willing to take the time and the increased degree of risk to get there. You know, I've seen my plastic surgery peers there aren't enough days in the week for them to do facelifts, nose jobs, eye lifts. People have the time right now, and they want to get those things done. It's cost effective to do these big procedures. They want to go all in and see big results. It's less office visits. I mean, I think in the new world, people are going to be less willing to come in like once a week for a series of 5 treatments. And most importantly, I think people are a little burnt out on low downtime, non-invasive procedures that are not giving the same amount of results. And there's a little bit of burnout. You know, there are a lot of technologies. I have over 40 technologies in my office, and I've definitely found that the technology drive, particularly with the device companies, has been towards a younger audience who would benefit from less invasive things. But, you know, even young people, sometimes the less invasive multiple treatments are not giving the level of satisfaction. So I think this is a really important shift. Fortunately, in my own practice, I do an enormous amount of non-invasive, but I also do non-invasive procedures. I very regularly do CO2 laser resurfacing under anesthesia. You're at home for a week or two. I regularly do tumescent microcannula liposuction, which is not a major operation, but it's not cool sculpting. So I really think that people are a little burned out. They want more out of their time and their money, and they're really seeking big results. I think we're also going to see a consolidation in the beauty industry. Again, not just in cosmetic dermatology or in my practice, but in the spa industry, in the hair color industry, in the microbleeding industry. We're seeing a consolidation. The weaker brands, the weaker practices are getting weeded out. I've seen many unnamed med spas close up. These are places that depend on volume. Their margins are small and they want volume. The Groupon culture. This is something I always said before COVID, that this kind of category of the beauty industry, I mean, listen, pigeons go where the crumbs are. When the beauty industry is growing, you have all types, all echelons of service from the low end to the high end. And it's really going to be the brands and the providers across the field that are going to survive because they could weather the storm. And they're more focused on quality of care rather than volume or just delivery of kind of drive-through services. So we're seeing med spas close. The strong are surviving. You're going to see this in skincare brands, makeup brands. You're going to see this in service industries as well as in the luxury field as well. And then one of my favorite topics, which I think I could talk about this for an hour. This is a story in and of itself, is the cheaters. Now, all service providers, again, whether you're cutting hair or injecting Botox or doing liposuction, have those incidences where their regular patient of years who always tells them how much they love them disappears for a little bit. And then they may show up a year later, 2 years later, and their head will be a little bit in between their legs, and they'll be like, I cheated on you. I went somewhere else. My cousin's sister's brother's a nurse who had a friend who's a doctor who was doing like a training session, and I got it for free, or I got it for my girlfriend convinced me to try this. And this is a very regular occurrence. And although some patients may leave me, that's fine. Many do come back. And COVID was one of those examples where people were not just trying out something new for their own kind of curiosity, but they were demographically shifted. They were in the Hamptons and afraid to come in New York. They moved out of state. And this is true of every aesthetic provider I've spoken to, particularly in the hair color industry and the cosmetic dermatology industry. And the fact of the matter is, it really reinforced to me what I knew all along, and this just tested it, which is there's no best provider out there. But the fact of the matter is, the provider you go to, if you're happy with them, knows you. They know what you like about your hair. They know what you like about your facial. They know how to do your Botox and your filler and your laser resurfacing. They know what your pain threshold is. They know what your pocket monetary threshold is. So my advice to everyone out there is, if you're happy with your provider, stick with them. If something is not going right with the care, or you're curious about wanting more, bring it up with your provider. If they can provide that service, great. If they give a good reason why you're not a candidate or can't do something, even better, because it's really about education. If you're unhappy, well, then of course you could seek care for somewhere else. But it was really amazing to see a lot of patients that really disappeared from my practice for 6 months, 9 months, a year, and seeing them all come back. And, a lot of them that came were quite apologetic. And I said, there's no need to apologize. There's tons of fear and demographic change. I'm happy to see people, and I'm happy to see that people see now the value in coming back to me. And again, this is not just because I'm the best. There are a lot of other providers that really experience the same thing. And I think the concept of and listen, there are some people that are just always looking for the next best thing. They're never happy. They bounce around from doctor to doctor. And the fact of the matter is, I'm not interested in curating patients like that. Neither should any beauty provider out there, because you want to develop a relationship. It's not just the skill in the hands and what you're doing. It's the skill in developing the doctor-patient relationship, or the hair care customer relationship. And that's the fun of it for me. And I think this whole COVID scenario and seeing people come back with their faith and their trust and their enthusiasm to look good in my hands, that's what it's all about. So that's the cheaters. So let's now see about what people are thinking about whether or not they want to get something done in the near future. Are you thinking about getting anything done? All right, guys. Are you thinking about getting any type of cosmetic enhancements? I've been tweaking throughout the whole pandemic. I started seeing patients on May 18th, so that was great. I'm chomping at the bit to get my cosmetic game on again because I haven't been doing it. I've decided that treatments are not my cup of tea. We don't like you out there. And I have gone back to treatments, but I'm thinking about next steps. A lot of people are thinking about what the next step is because, again, people have been feeling a little burnt out lately. And they're wondering what the next step could be. For some people, that's a facelift, getting their eyes done, and maybe moving from a fraxal thulium to a fraxal repair to something more aggressive. And I think that people are questioning all these type of things. So let's see what we got here. And the poll, let's share the results. And as I thought, people are chomping at the bit. People have kind of stepped away for a little bit, understandably, right? But they're looking to get back into it. 22% of people have been tweaking and only 3% have decided, well, these are the people listening to me. So they thought it wasn't their cup of tea. And there are some people, a third of you, that are thinking about next steps. Okay, so far, these polls are working. Shut that down. Okay, so now we're going to talk about what treatments are people doing. And in the immortal words of the Beastie Boys, it is about body moving, body moving. People are like body obsessed right now. Most of you who know me and my brand, half my practice is off the face. I do an enormous amount of body treatments, both minimally invasive, moderately invasive, and invasive. My first disclosure out there for people that aren't familiar with me, that we are not building supermodels here. Our goal with body procedures is not to turn full-figured people into skinny people, to turn normal people into supermodels. That is not the goal. My goal is to make people feel comfortable with themselves. And whether we like it or not, we are very visual creatures, and we take feedback in our mirrors. We take feedback amongst our loved ones, our friends. And, I am all for positive body image, no matter what shape or size you are. But that doesn't mean there's not room for improvement. And trust me, I have supermodels as patients. They are not perfect. And they too are also uncomfortable with some aspects of their body. So it's really about empowering people. It's really about making people maybe feel like they once did, because our bodies do change, our metabolism does change. And it's about making people feel like a better version of themselves. Okay. And I think one of the reasons why the body is such a huge rage right now is because summer is coming. We are getting vaccinated. People are probably going to be wearing less clothes, and everyone, including myself, wants that hot girl summer. Okay. So body is really big right now. In the 22 years I've been practicing tumescent microcannula liposuction, I've never been so busy. I get my yoga on to keep my shoulder in shape and to stay live. But body sculpting is a really big thing right now. I'm in the OR every day doing 6 to 10 procedures a week, separate from all the other types of body procedures I'm doing. Tumescent microcannula liposuction is the rage. And then I really think it's the perfect storm for this right now. First and foremost, sadly, a lot of people gained the COVID-19, and that's not the virus, that's the pounds. I always say body sculpting with me, I'm not the first 10 pounds, I'm the last 10 pounds. I'm the icing on the cake after you've maximized diet and exercise. But for a lot of people, it's just been tough. They've gained 5, 10, 15 pounds. And if you're middle-aged, it's very difficult to shed that. I think everyone's exercise routine has changed. As much as the online exercise boom has changed the way we exercise, it's been difficult for people. We're going to be summer socializing. We're going to be in bathing suits. And also, again, I've said this for many years, though, although I have almost every non-invasive body sculpting device out there, I think people are burned out, and they realize that things like Cool Sculpting and True Sculpt and Sculpture and certainly Kybella, which I'm certainly not a fan of, they're not magic. They're they're home runs for a single-digit percentage of people. And still to this day, 30 to 40% of my tumescent microcannula liposuction patients have spent thousands of dollars on non-invasive treatments. And, listen, a lot of med spas out there, a lot of doctors, if they only have CoolSculpting and someone has issues with fat, they're going to sell them CoolSculpting. They may not even have other non-invasive options, let alone do tumescent liposuction. And they're certainly not going to refer out. So for everyone out there that's a consumer, doesn't have to be me, but if you're seeking fat removal procedures, make sure you go someplace that has a full spectrum of options. Because what's my saying? If you only have a hammer, everything looks like a nail. So make sure if you're seeking body treatments or facial treatments, there's more than one option out there. And I really think the non-invasive, particularly the CoolSculpting market, has burnt out because it's good for a very specific candidate, and that is all. Next poll. What are your thoughts on fat removal procedures out there? I have tried either non-invasive or invasive procedures. I want to try fat reduction procedures. I have too much in some areas and not enough in others, but I'm very wary about doing anything about it, which you should be. And then finally, the universe put everything where I need it. I am good. That's not going to last forever. All right, we'll give that a couple more seconds. Anybody? Bueller? Share the results. Okay, a lot of people, over a third of people have tried stuff before, and another third of people want to try. 2/3 of people have either tried or want to try. Very small percent of people. This is what I said, guys and gals, even the supermodels, even the people that are perceived as perfect, no one is universally happy. And that doesn't mean it needs to be preyed upon, but there are realistic concerns that everyone has, and there are realistic options for everyone out there. But understandably, a quarter of the people are wary. And the fact of the matter is there's so many things out there for body sculpting. There's so many things out there for fat removal procedures right now. And a lot of providers have very limited options. They only do one thing. Again, I'm not the only gig in town that has all these things, but there aren't that many places like mine where really try and offer the full spectrum. So wherever you are in the world, it's important that you make sure you're given several options. All right, I'm going to move on, guys. We are, okay, this is what I'm loving, the mommies. Okay, we're going to talk about a little mommy rejuvenation right now because I've been doing mommy stuff for 20 years, and the technologies have gotten so good of the things we could do post-pregnancy. There are a lot of misconceptions. I want to address them. There are so many mommies coming in right now, and there's not a day that goes by where I'm not seeing 3, 4, or 5 mommies. In terms of mommies, people love this term mommy makeover, and I'm not really down with that vernacular. We don't need to make over anything. We need to rejuvenate. I much rather mommy rejuvenate and get them back. Most mothers that are coming in, they're frustrating. They're trying to lose weight. They may not like their C-section scars, stretch marks, all these things. It's tough trying to get everything back in order. And, a lot of mothers feel pressure from those around them that they can't lose the weight, that they have stretch marks. There is a lot of social pressure amongst the mommies. Aside from the aesthetic aspects, are you breastfeeding? Are you not breastfeeding? How long are you doing it for? Are you using what kind of formula are you using? Do you have a baby nurse? Do you not have a baby nurse? And, just as a physician who's gone through the whole medical training, I tell people the only thing that is important is what you feel comfortable with, not what other people are doing, because everyone is different. And mommies, first and foremost, need to be well rested, need to be happy, and they need to be comfortable. And that is the best thing you can do for your baby. So it doesn't have to do with everyone else there. And if doing something to make you feel like Stella's getting her groove back, well, by all means, there are options to do it. And, a lot of people, I always tell people with anything, you want to try and do as much as you can on your own. But as soon as your OBGYN says you can exercise, as soon as they, if you're not breastfeeding, there are certain things you can and cannot do. You can't do injectables while you're breastfeeding. You can do lasers. You can do skin tightening. There are things you can do. And the earlier, the better. I always tell people, clean up your room before it gets too dirty. And as soon as your OBGYN says you're good for exercise, and you're not breastfeeding, you have a lot of options out there. So what can Stella do to get her groove back? Well, we talked about body sculpting. And again, I tell people really give yourself 3 to 6 months to lose some weight before I do any really body sculpting procedures. It's not going to come off just like that. But if I am going to do something, and again, for women, their hips turn out. You've heard me on social media talk about the thut a lot, that area between the thigh and the butt that sticks out. That's not just fat in the outer thigh. It's also because the hips turn out for obvious reason when you're childbearing. So what happens is the hip dip goes in deeper. We lose volume in the tush. It goes flat. The outer thigh goes up. So treating the thut, which is a combination of microliposuction in the outer thigh area, I purify the fat and I move it up. It's not giving you the Kim Kardashian. It's just moving the fat to a better place where it once was to give you that lift and minimize that protrusion. The other thing, which is very popular, which is a constant source of laughter in my office, is the FUPA. Many of you know, the medical acronym is fat in the upper pubic area. For those of you know the variations of the OPPDom of the FUPA, there are other names for it. Nurse Jen Kennedy, she gave me the new vernacular of the vajumic, which some people call the vajelli. This is all that area. Like when you have a C-section scar above the pubic area, clearly a lot of women have this problem. It is a very, oh, Nurse Jen is here. I shouted you out. Anyway, the vajumic, that area above a C-section scar, above the pubic, it's a very frustrating area. Even if you get down to your ideal pre-pregnancy weight, this is an area that a lot of women are still frustrated with. It is extremely easy to remove this area under local anesthesia. You can probably go out to dinner that night, certainly back to work the next day. It's under local. You don't need to be sedated. We use ultrasound to melt the fat, remove it. You put a bandage on for 24 hours. No non-invasive fat removal procedure is going to do this, guys. Tumescent microcannula, laser liposuction is the way to do it. So thanks, Jen, for the vajumic. C-section scars, vascular laser technology is getting better and better. Red stretch marks, red C-section scars. The V-beam Prima, which is the newer generation of pulse dye laser, is amazing for this. EMSCULPT technology. I know all you EMSCULPT fans out there and BTL people listening. This is the time to talk about the EMSCULPT Neo and the Emsella. This has really been groundbreaking in terms of what we can accomplish post-pregnancy. The original EMSCULPT technology did it. The new EMSCULPT Neo, the new generation of it, closes that stretched out diastasis that people get. Now, you can treat the diastasis years later, but the time to treat it is soon after. So as soon as the OBGYN says you can go back to exercise, this is when you want to hit the EMSCULPT technology. It uses HIFEM or magnetic resonance technology, similar to an MRI, to hyperstimulate the muscle. It will flatten the belly that sticks out. It will close the diastasis, and it will improve the core muscle. And now the new EMSCULPT Neo, which we'll talk about in a little bit, will help with skin and muscle as well. So, 6 weeks after giving birth, you can start this. You could even do it while you're breastfeeding. Also, the Emsella technology, which uses the same technology, which focuses on the pelvic floor. It was originally developed for urology, for women with mild to moderate urinary incontinence, which is very common after when you laugh, when you jump rope, when you exercise, you pee a little. There's no need to have that anymore. Now, for the more severe cases, obviously, you need to seek the attention of a urologist. But the Emsella device, which is a chair that you sit in for 30-minute appointments, it's basically like doing 20,000 Kegel maneuvers. And that combined with the EMSCULPT, in my mind, has changed the mommy rejuvenation world. And, it should be part of any mommy rejuvenation makeover. Stretch marks, fractal resurfacing, microneedling, melasma, broken capillaries. I mean, you women, you go through it for us guys. So, there are so many things that we can do to help out and get the skin back in order. There are a lot of great treatments for melasma, not only laser, not only topical, also oral therapy now with tranexamic acid, and also broken capillaries all over the body. So The time to start is soon after, and we're always excited to see the mommies in the office. Now, I'm going to get to cellulite because people have been cellulite crazy. Probably the #1 questions I get on social media and my DMs, and particularly for this podcast, is cellulite. And honestly, I think the release of the injectable drug 𝐁𝐸 is part of the driving force of the cellulite craze. I am going to go into how I feel about it down the road. This was FDA approved for moderate to severe dimpling. It is not a treatment that improves texture of the skin. It is not a treatment that gets rid of irregular fat deposits. It does not improve elasticity. It does not improve color. There are so many reasons why people have cellulite. There's so many treatments that I can recommend, but I don't want people to be confused about 𝐁𝐸. 𝐁𝐸 is a drug called collagenase, and it decreases the fibrous bands that cause the pulling down tethering that people have with deep puckering. So unfortunately, like with every technology and every drug that's out there, it comes out and people just start using it on everything. And it's just really not appropriate for that. I use it only for moderate severe dimpling. It causes an enormous amount of bruising that could last really 2 weeks. It could cause staining of the skin. You have to do it once every 21 days for 3 times. And it works. It's not magic. Again, I'm only going to use it in combination with other things for people who have that really kind of like someone took their thumb and poked it into your butt. That's what it works for. There are a lot of other things with less downtime and more efficacy that I think are more the mainstay. Everything has a little bit of downtime with the body because the fact of the matter is the body heals differently. Whether you're doing a laser for the chest with Fraxel or whether you're doing injections, it always takes twice as long off the face. So anything you do injection-wise with the body, you could have 1 or 2 weeks of bruising. So you have to consider this because summer is coming. And with 𝐁𝐸, if you're going to have sheets of bruising for 2 weeks and you have to do it every 21 days for 3 months, I have patients already who are like, it's game over. I'm going to wait till the spring. And again, it's only going to be for those bigger dimples that you have. So for those of the consumers out there, I'm happy that 𝐁𝐸 is in the tool chest. I'm positive about how it's going to be used, but do not get sold it for all types of cellulite, and be aware it's going to cause trauma. It's going to cause bruising. There could be staining of the skin. You know, 𝐁𝐸 to me is like the 𝐏𝐳𝐵ELLA of cellulite. When 𝐏𝐵ELLA first came out, everybody was, it's the injectable liposuction. It's going to melt everything. And the fact of the matter is, I hate 𝐏𝐵ELLA. It causes an enormous amount of trauma. There are more side effects with 𝐏𝐵ELLA than there are with liposuction. You have to do multiple treatments that cost thousands of dollars per treatment, and there are unpredictable results. If you're going to go through trauma and have unpredictable results, by all means, you want to be guaranteed an end result. So again, I'm excited about 𝐁𝐸. I take everything with a grain of salt. And as with every other treatment, it's about how we combine them with things that we know are tried and true. Sorry, 𝐁𝐸 people out there, but that's how I feel about it. There are several reasons why we get cellulite: uneven fat deposition, loss of elasticity, and the treatments that I've developed and been involved in doing for all my patients have been very, very successful. EMTONE, also another device by BTL Aesthetics, is a radio frequency and a shock wave mechanical energy therapy that also helps break up the fibrous bands. It does tighten the skin, and it's probably the most non-invasive treatment we do that helps cellulite. And you can do it for maintenance treatments throughout the summer. It works very well. Many of you who know my practice are very familiar with one of the treatments I developed, BIOSTIM treatments, where we use things like Sculptra and hyperdilute radius to fill in the waviness and even out the irregularities in the skin. And there are some patients that require surgical intervention. The device I'd use called VASOR-Smooth, again, similar to tumescent liposuction, I'm able to remove that uneven fat, even things out, and tighten skin from underneath. So again, there are options. There is no best. It depends on who you are, what you are trying to achieve. Now, new and exciting things, people. I want to talk about knees, because everybody for the last few years has been wanting to talk about knees. And I have to tell you, as I pour a little bit more 𝐂𝐻𝐸, there's been limited options. So I've been working for a while to try and develop a combination treatment. And one of the things that I've been doing for many years that I really found has advanced and has really changed the game for me on body now are suture suspension techniques with threads. And I've really, for the last several years, avoided using them on the body because I just really didn't think the technology was there. People are asking about putting sutures in the breast. People are asking about putting sutures in the butt. I really think, you know, I don't want to do something unless I think I can make a very significant difference. There's so many ways to spend your money, your time, and whatever level of risk is involved in these procedures. I want at least a third base, if not a home run for my patients. But now the suture suspension techniques have gotten better and better. The quality, the thickness, and the effect of the sutures have gotten better. So one of the combination procedures I developed, we call the PFRANKMD knee lift, because again, they're very, even if you get a thigh lift for many patients, if you go to a plastic surgeon, a body surgeon, and you're doing a thigh lift, it's limited what you can accomplish in the knee area because it just doesn't translate that low. So I do a combination of treatments where I use biostimulatory products, again, like Sculpture and hyperdilute radius. A lot of people have loss of volume around the knee. That mechanical trauma of constantly moving causes everyone's worried about getting rid of fat in the thighs. But the fact of the matter is you need soft tissue, adipose tissue, to create suppleness in the skin. And for a lot of people, we have thinning of skin, we have loss of volume, and using biostimulatory treatments could really give a long-term benefit. Also, the advent of energy-delivered microneedling, body microneedling with Morpheus, Vivace, Virtue. These are really changing the game for body treatments now, which I'll go into in the future. And then adding suspension threads from the mid-thigh down to the knee, combining all those treatments in a simple half-hour procedure that I do is really lifting up knees. Now, again, if you have 30 pounds to lose, the skin's going to be too heavy. But for a lot of people who take good care of themselves, exercise, eat right, are relatively thin, we can make really dramatic differences without having to do a thigh lift. I tell people you can't exercise for 3 or 4 days later. Stay tuned on my Instagram. You know we're going to post some good videos about before and after and how the PFRANKMD knee lift is done. And I think it's going to be the summer of knees. So you won't need to have to avoid wearing skirts and dresses in that manner. So that's one of the technologies we're excited about. Let's talk a little bit more about, don't worry, we're almost done, guys. I know you've been with me now about 45 minutes. We'll close this up. I'm going to do some rapid fire questions, and I appreciate all your attention. Most of you are still here. The Neo technology, I want to go through some of the things we talked about back in October. We finally have the EMSCULPT Neo. The difference between this and the old EMSCULPT technology is that they've added radio frequency energy that not only enhances the efficacy of the muscle stimulation and the hypertrophy, but it also helps with increased fat removal and tightening skin. It's the ultimate trifecta. I just got my second EMSCULPT Neo. I have 3 EMSCULPTs in my office, and it's changed the game in body. It's not for everybody. Again, like all things, it can be oversold. It's not going to do what liposuction does. It's not going to do what exercise and nutrition does. But for most middle-aged old folks like me who do everything they can, but they hit a wall, they want a little bit more rip in their abs or lift in their butt or definition in their arms, the HiFem technology with BTL aesthetic devices, EMSCULPT technology, there's no replacement for it. It's done for the body what Botox did for the face 20 years ago. And there are a lot of technologies out there that are trying to keep up with it. And I think BTL aesthetics and EMSCULPT technology are really at the forefront. And there are going to be more things to come. I'm looking forward to and waiting for the new arm pieces that are going to come out for the calf, for the thighs, for the arms, and really seeing it take to the next step. In terms of other body treatments, microneedling has become the new laser of the next generation. There's so many different variations of the theme of microneedling technology. I have Infinity, Vivace, Morpheus, the new Virtue. Each are unique in their own setting. There's no one of those technologies that I love. I use Morpheus a lot for my surgical. When I do face tight, I use that a lot for surgical tightening. I love Vivace for the face. Virtue which is a newer one on the scene. It has a body-specific handpiece that I'm now using as an investigational device, hopefully to be FDA approved soon. We're now using single individual needles investigationally to try and melt fat pads under the eyes, in the jowls. And I really think the technology of energy-delivered needling devices is really booming more than any other category now, certainly more than laser or RF and ultrasound technology. And I think its ability to be used on all skin types, although there's risk with all things, it has the most diverse ability on all skin types out there. Now that there really is no face of a cosmetic patient, we see people of all socioeconomic classes, genders, all skin colors. I think these energy delivered microneedling devices are really catering to that broad spectrum of patient out there. And it's just very exciting to see. So we're going to take our last poll, and then we're going to go to the rapid fire question. What are your current overall COVID predictions? Okay, guys, let's launch this. I am feeling strong. We are rapidly emerging from a bad dream and into the roaring 20s. Wow, people are killing it with that already. I feel cautiously optimistic. It's getting better, but I don't trust it. I think things are going to get worse before they get better. All right, those are pessimists. And not much has changed for me at all. Let's hear what you have to say, people. One more second here. Still a couple of people are chiming in. They're waking up from their slumber. Okay. Let's share that result. So most people agree with me. Cautious optimism. I mean, I'm very optimistic, but I'm not trusting anything 100%. Cautious optimism. But I'm kind of more of a combination between A and B. I'm feeling very strong. I don't know about I don't know if I want the roaring 20s, because you know what happened after the roaring 20s? The Great Depression. So we don't want things to overheat. And I can tell you from speaking to my friends in business, culture, and service industries that things are heated up. And that is all great, because everyone deserves to make up for last year. And I'm all for stimulating the economy, but I think we all have to be careful out there and not get too crazy. Two people thought things were going to get worse, we can get better, but okay, we'll see about that. So let's stop sharing that now. Ladies and gentlemen, I thank you for spending this time with me. I want to do some rapid questions out there. So I'm going to talk to my friend, my IT manager here, Olivia. Okay. We give a shout out to Olivia for preparing all this and making me look as good as possible on Instagram. Thank you, Olivia Grossman. Come on, show your face here. Come on, get in here. Come on, show a quick face here. This is Olivia. Okay. She makes a lot of the magic for us and delivers my message with my creative team. Also, thank you, Annie Frank. Okay, my sister, my director of operations. The dream would not be true without her through COVID, through right now, and through the future. The brand is defined by her and I appreciate both of these people for doing what they do while I do what I do. So let's go to some rapid fire questions, people.
Okay, so you guys put in a lot of rapid fire questions. We're ready to go. So Dr. Frank, can you explain 𝐞𝐲 and the results you have seen?
Well, I explained 𝐞𝐲 already. The results I've seen have been mild to moderate with lots of downtime and disgruntlement. That's my feeling thus far.
How are you seeing the use of injectables shift as we're coming out of quarantine?
How am I seeing injectable shift? I think people are catching up. If they ever knew what it was like to not have their injectables anymore after 7 years, they're now running back and being like, fill her up, doc. And I have to tell people that if you haven't had injectables in a year, you may find if I do exactly what I did a year ago, they may not last as long, because most people come back before they're on tank empty. That's what I tell people. I generally like to color roots, not reprocess hair. So if you're doing something for the first time the same way as pre-COVID, it may take a little time to get your groove back on.
I have very muscular arms, but sagging skin underneath. What do you think can be done?
Sagging skin, muscular arms. You know what? If it's very superficial sagging, we use energy delivered microneedling. If there's some fat in the arms, tumescent liposuction, 24-hour recovery with Body Tight. We're able to tighten with RF on the inside.
For someone looking for both lipo and cellulite treatment, in which order do you recommend?
They can be done at the same time. When I do tumescent liposuction on areas, there are certain instrumentation. 𝐕𝐝𝐻𝑆r Smooth is one of them that could address the cellulite as well as removing the fat. I usually give it a month until after surgery to consider whether I need to do external treatments as well, but I try not to sell more than one treatment at a time to a patient.
Is it possible to get rid of lumps on the stomach that are a result of liposuction done years ago?
Absolutely. One of the most common causes of lumps on the stomach actually is not from old traditional liposuction. It's from bad cool sculpting. And I often use biostimulatory fillers, EMTONE, and microneedling. Again, nothing is worse than trying to do a procedure to get rid of fat and you end up with a lumpy, bumpy belly. So again, be cautious of non-invasive treatments. They are not risk-free, people.
Can anything be done about a banana roll in the back of the thigh?
Banana rolls we have to be very careful of. If you are too aggressive in using any technology or technique to remove that little lump below the booty, it may look good for 6 months, a year, 2 years, but the butt can fall because there are ligaments there that are holding up the tushy. So conservative removal is necessary.
Is Body Tight an option for upper arms for us older folks?
Body Tight is an option. Again, I'm into third bases and home runs. Once you get past 65, it can be difficult to improve the quality of the skin there without doing a small body lift procedure. But by the way, there are some great surgeons out there that do great little lifting procedures, short scars. And when I feel a patient is beyond what I could accomplish with them minimally invasively, I refer out.
Can you use Ultheraphy above the knees?
You can use Ultherapy above the knees, above the belly button. Ultherapy, we do, RF and ultrasound devices we use everywhere on the body. Again, it's about managing expectations and getting the best result.
What is the best for plumping skin on the butt, and would RF on the butt lead to undesirable fat loss?
I generally, superficial RF improves cellulite and tone. Deep RF, like we use in TrueSculpt ID, and sometimes in the newer EMSCULPT, we have to be very cautious because, believe it or not, we want the fat out of our ass when we're young, but we need the fat back in it as we get older. So I often am transferring, using the best filler in the world, your own fat. I put it back into butts as they get older, not to give them something they never had, but just to give them back what they once had. And it not only increases the volume, gives lift, but it also smooths the cellulite. When I do that, then I hit them with the EMSCULPT to build the muscle.
How/where is PRP most effectively used on the body? I just heard about someone getting it to help lift breasts.
PRP for the body, I'm not into it. I'm not into it for the face either. If you have joint problems, you could use it in your joints. But, I just think PRP definitely has science behind its use in the scalp for hair loss, particularly after pregnancy, telogen effluvium, post-COVID, perimenopausal hair loss. I know it's an Instagram fad, microneedling PRP into the skin. I think it's a lot of money, a lot of trauma, not that much science, not that much result. And I think there are just better options out there for people. Next.
Is Botox always the answer? What alternatives are out there to substitute, especially if you're in your early 40s?
Neuromodulators, let's not use the word Botox because that's a trade name, but neuromodulators are not from everybody. They can become a law of decreasing returns for most people as we get older. There are limits to what we can accomplish, but it is a household name for a reason. Botox, neuromodulators, Dysport, Xeomin, Jeuveau, and they kind of have the monopoly on rhytids or wrinkles of motion. So, you can't laser and fill lines on the forehead. So neuromodulators kind of have the monopoly on that, and has proven to be a great treatment, not only for lines that young people have, but prophylactically moving forward.
How to make a face appear less long and narrow?
Well, volume replacement is volume changes can do that. But, I'm very cautious about dramatically changing faces of the shape with fillers because it's not changing bone structure. And the long-term outcome of making dramatic changes in facial shape, what God did not give you as fillers, can be a detriment in the long term. A little difference in the lip, cheekbone, enhancing a jawline, protruding a chin. These are all valid things. But when people want dramatic changes, they have to reevaluate what their intention is, whether or not they need more reconstructive plastic surgery, and whether or not they just have to learn to accept things the way they are. Oh, wait, hold on. This is a good one. Blepharoplasty alternatives. Well, we all develop, including your doctor, heaviness above the brows. There's always the neuromodulator or Botox brow lift. I do a lot of CO2 laser resurfacing. Thermage and Ultherapy do not work around the eyes, but laser resurfacing with downtime does give a good surgical result. And there's nothing wrong with doing a blepharoplasty. There is a great one. How soon after vaccine is it safe to get injection? This is like a great question. You shouldn't do it right around the vaccine. Your immune system's being stimulated. You shouldn't do anything. You shouldn't get a facial, a chemical peel, a laser, a massage. But you know, and certainly if you're not feeling well from the vaccine, you shouldn't do it. But a week before, a week after, I think it's fine to do everything. I think it's been totally overblown, the risk of vaccine and fillers. There's certainly no issue with Botox. I see 40, 50 patients a day come through my practice, inject 25 people a day. It has been a small handful of people that I've seen have even the slightest reaction, all of which have been easily reversible and treatable. The fact of the matter is people, hey, Michelle Berger, nice to see you. Saying hello there. I think it's a very rare reaction that you could have with any type of vaccine, with any infection, dental procedure, or even just having the common cold can cause a transient inflammation in filler.
What is the best treatment for hyperpigmentation on African American?
Well, there are technologies that are good for darker skin tones. Pico technology is great. You have to be very cautious with Fraxel technology. You can't use CO2 lasers. There are treatments for darker skin tones. And most importantly, I try and train my patients with skin of color that the sun is just as much as their enemy as it is for Caucasian patients. Lighter skin tones get more fine lines, wrinkling, thinning of skin. Darker skin tones tend to get more darkening. So it's important. An ounce of prevention is always worth a pound of cure. Sun protection, good topical therapy, serums, and some non-ablative laser therapies are great for my darker skin patients.
What to do for a drooping forehead?
A drooping forehead. Well, a brow lift, a laparoscopic brow lift, my buddy David Rosenberg does these great, is such an easy weekend recovery procedure. Neuromodulators like Botox and Xeomin, you can get a brow lift where you could just get a little kind of like upward few millimeters. I'm going to tell you what you can't do. Those kind of snatched brow lift threads that you see on Instagram, they are bullshit. They don't last. If they do look good right afterwards, they're gone in a couple of days, 2 weeks. They could have unevenness. You could see the thread. I love doing thread lifts. That's for another webinar of sorts, but I do not like them in the brow. I have done them. There may be 1 in 100 patients that I think it's beneficial for, but using neuromodulators or getting a laparoscopic brow lift, or actually sometimes using filler and volumizing in the forehead and the temple give the best result.
This one's a little different for you. What to do with menopause skin spots?
Menopause skin spots. So that's hormonal like melasma. Again, combination of laser therapies. You have to be cautious because the same lasers that can make you better, if in the wrong hands, can also cause a problem. So this is a good way to close this out, which is it's not what you do in this world, people, not in any aspect of life. It's how you do it and who you're doing it with. Keeping good people around you, good doctors, good friends, good family, good loved ones, good energy, not just in lasers, but in vibes. And doing the right procedures with the right provider, not just me, who has the full spectrum of options and is catering the treatment to what your needs are specifically, not your friend, not the patient before, to give you the best result with the least amount of risk and the treatment that is ideal for you. That's the way to go through life, people. And I want to thank you all for joining me on this Hot Topics happy hour. I'm so glad we are coming out of all this. Please, everyone, get vaccinated. The pros outweigh the cons. We're in this together. And I appreciate you all for being there with me through all this, having faith in me, and enjoying the journey and getting on the ride. All right. Thank you so much, everybody. Pro Aging Playbook. You want a signature? Come on in to visit me. Follow us on at Dr. Paul Jared Frank, and I will see you all shortly. All right. Thanks, guys. Bye-bye.